Hi friends, my name is Preeti. So today I'm going to discuss about general anesthetics and local anesthetics. So anesthesia is nothing but it is a medical treatment that prevents the patients from feeling the pain during procedures like surgeries and some tests. Okay, so it is a temporary loss of sensation. In general anesthesia, the whole body of the patient will be unconscious. Okay, whereas in local anesthesia, only a particular area of the body lose its sense. Okay, so now we'll see the stages of general anesthesia. So these are the stages of general anesthesia. There are 4 stages. The first stage is analgesia. It means first there is a loss of pain and the person will be in a conscious state. Whereas in delirium, there is a beginning loss of consciousness and the respiration will be irregular. And in third stage, it is surgical anesthesia. There is a complete loss of consciousness and BP is normal, whereas respiration also will be regular. And the fourth stage is medullary paralysis. There is a complete depression of all central activities. Okay. These are the 4 stages of anesthesia, general anesthesia. Now we'll study about the drugs. So here you can see general anesthesia, loss of consciousness and pain. It is of 2 types, inhalation and intravenous. Under inhalation, we have gases and liquids. Under gases, we have nitrous oxide, whereas under liquids, which are volatile, halogenated and non-halogenated. Under halogenated, we have halothane and fluorine, sevoflurane, isoflurane, and desflurane. So halothane means definitely they contain a halogen. So the halogens present are bromine and fluorine, whereas in enfluorine, it is fluorine, and in sevoflurane also fluorine, isoflurane, fluorine, and chlorine. In desflurane, it is a fluorine. Okay, the detailed structures I will be given in one more video. Okay, and in non-halogenated we have ethers. These are all inhalation anesthetics, whereas under intravenous we have inducing agents and slow acting agents. Under inducing agents we have ultra short acting barbiturates, thioamylol, thiopental, and methotrexate. Under non-barbiturates we have propofol and etomidate. See, this propofol is it acts on the modulatory site of GABA A receptor, okay, and it enhances the GABA activity. And under slow acting agents, we have benzodiazepines, diazepam, lorazepam, and midazolam. And under dissociative anesthetics, we have ketamine. And under opioid analgesics, we have fentanyl compounds. So now we'll study about local anesthetics. So in this condition, the patient will be awake, but only a particular area of the body will be losing its senses. Okay, and the drugs are classified into 2 types, amide type containing drugs and ester type containing drugs. And this amide type containing drugs, amide group containing drugs, they contain 2 I's in their name, 2 I's. Okay, whereas ester type, they contain only 1 I. This is the general structure of amide type drugs. Okay, this is the amide group and this is the whole structure. And these drugs, they metabolize slowly in the liver. So the duration of action will be for a longer time. Whereas ester type, they are metabolized rapidly by pseudocholinesterase enzyme. So the duration of action of them will be for a shorter time. So now we'll study about the amide type drugs. These are of 2 types, longer acting and intermediate acting. Under longer acting, we have bupivacaine. See, we can see 2 I's. And levobupivacaine, etidocaine, ropivacaine, and dibucaine, which is also called as syncocaine. Okay, I means they are injectable. Okay, these are the first 4 drugs are injectable, and the last one is both injectable and surface anesthetic. And the under intermediate acting, we have lignocaine, mepivacaine, prelocaine. Okay, the first one is both injectable and surface, and the next 2 are injectable. This lignocaine and prelocaine forms a eutectic mixture of local anesthetic on the skin. So these both combinedly they act as surface anesthetic. And under ester type also we have long acting, intermediate acting, and short acting. Long acting, we have tetracaine, which is both injectable and surface, and cocaine, which is a surface anesthetic, and it causes hypertension. Okay? And it is an ocular anesthetic. Okay? And under short acting, we have procaine, chlorprocaine, benzocaine, vitamben, and propcaine. First two are injectable and the last three are surface. So here you can see chlorpromazine and promethazine, they act as local anesthetics. Whereas cimetidine, see this chlorpromazine and promethazine we got in antipsychotics. Okay, the antipsychotic drug which act as local anesthetic are these two drugs, and cimetidine is an antihistaminic drug. So it acts as a pre-anesthetic. Okay, and under others we have pramoxine, diclonine, and oxytocin. These are surface anesthetics. Under surface also we have soluble and insoluble. Okay, under soluble we have tetracaine, lidocaine, cocaine, and benoxynate. Okay, these are soluble surface anesthetics, TLC. And under insoluble we have benzocaine, oxytocin, and butamben. Bob. Okay. In this, just remember which is a amide type and which is ester type, and which is a long acting drug and which is an intermediate acting drug. Okay. So now we'll discuss about the mechanism of action. Okay. The mechanism of action of inhalation general anesthetics is, so when they are administered into the body, then these drugs, they increase or they enhance the binding of GABA to the GABA A receptor, which results in opening of the chloride channels, and there is an influx of more chloride ions, which causes hyperpolarization of the membrane, and there is a reduced neuronal excitability. Okay, hyperpolarization leads to the reduced neuronal excitability, which leads to CNS depression. Okay, like that, in this way, the person is made unconscious. And then intravenous, here the agents are barbiturates and benzodiazepines. Okay, we know that GABA A receptor has barbiturate binding site and benzodiazepine binding site also, but the function is different. Barbiturates increase the duration of opening of the chloride channels, whereas benzodiazepines increase the frequency of opening of chloride channels. Okay, but the result of both the drugs are same, CNS depression. Okay. Next, we'll study about the local anesthetics. So here, the mechanism of action of these drugs is, these drugs, when administered, they block the sodium channels, voltage-gated sodium channels present on the axonal membrane. Then what happens? There is no entry of sodium ions into the cell. Okay. Then it results in no conduction of action potential. Then what happens? It results in local anesthesia at that particular site. Okay, general anesthetics acts by causes the CNS depression by opening of chloride channels, whereas here local anesthetics, they act by blocking the sodium channels. Okay. And next, we see the differences between general anesthetics and local anesthetics. So here, general anesthetics, they mainly act on CNS and causes CNS depression directly. Whereas local anesthetic, they act at peripheral nerves, only the area which we want to make unconscious. Okay, only a particular area. It blocks conduction and generation of impulse in that particular area. And here pre-anesthesia is required because here we are giving the anesthesia to whole body. Okay, before giving the main drug, first we will give the pre-anesthetic agent. Whereas here pre-anesthetic is not required. Okay, and it is general anesthesia is given during major surgeries, and here it is given during minor surgeries. And it is more toxic, whereas under local anesthetic, it is less toxic. And in general anesthesia, we can see generalized loss of consciousness, whereas in local anesthesia, only the pain sensation is lost locally. Okay. These are the differences. And one more thing is the famous singer, dancer, and songwriter Michael Jackson died due to the overdose of propofol. Okay, so that's it. These are general anesthetics and local anesthetics. Thank you so much for watching my video. We'll meet in our next video with opioids. Thank you.